Welcome back, everyone. So, continuing on this great momentum built up by the previous two speakers, we will now dive deeper into the topic of spiritual care. Starting off the session, may I invite Sister Mary Kristin Ng, and Sister Kristin is a grief counselor working for Assisi Palliative Care, or better known as Aspect Hospice. She has over 10 years worth of experience working in palliative care as a counselor and many more years experience working and training other counselors as well as working as a public health nurse before. Sister Kristin will be talking to us about grief and bereavement, mobilizing the community. Please welcome Sister Kristin to the stage.
Experiences in grief and bereavement counseling. Before I start, I would like you to understand what I mean by some of the words I use for counseling. First one is connectedness. Connectedness is an energy that exists between people when they feel heard, seen, and valued. Connectedness is deepened when people are courageous enough to share their vulnerability. So what is vulnerability? It is uncertainty, risk, and emotional exposure. When we speak about the courage to share our vulnerability, what I mean by courage is the power to let go of the familiar, because grieving is something very unique to each person. What do you need in order to be a companion to the bereaved? I think all you need is yourself. Try to immerse in life so that you can live fully and consciously cultivate courage, compassion, and connectedness. To wake up in the morning and say, no matter what happens, I am part of life and I am enough. There will never be enough of counselors. But the opposite of scarcity is not abundance. The opposite of scarcity is simply enough. I am enough. However, one thing that is very necessary is the willingness to practice and cultivate this skill. No one can engineer an emotional, vulnerable, and courageous process into an easy one-size-fits-all formula to give to you. So now we start with the visiting proper. As soon as we get in for the first visit, it is important for you who are doctors here, including the nurses, be very sensitive to their vulnerability, but honest about their health condition. Explore their expectations of well and explain what is reversible and relievable as opposed to a total cure. For grief counseling, we are not there to settle or fix anything. We are there to support our active listening with our active listening and presence. Be alert to trauma pains. Be alert of the feelings of guilt. Our presence is to give them time and space to grieve their loss. Later on, if you do not understand what I mean by trauma pains, please ask during the questioning session. It is very important that those of us who sit with the bereaved learn how to listen. We need the ability to share someone's feelings or experiences by imagining what it would be like in that person's situation. We need the skill or ability to tap into our own experiences in order to connect with an experience someone is relating to us. Third, we need the ability to perceive someone's situation from the other person's perspective. People with high levels of empathy are both givers and receivers of empathy. They use phrases like, I understand what you're trying to tell me. It's okay, it's normal. I can only imagine what that would be like. This allows others to tell their story without going into one of our own. So when we go in with the family members for the first time, it is important to bond with the patient, even during the first initial phone call. And as a counselor, we have to ensure privacy and offer confidentiality unless the patient indicates otherwise. Remember that grief is a natural, normal response to loss, not pathological. Acute grief is intense and all-encompassing. Integrated grief is after adaptation to loss. And of course, if there is no integrated grief, it leads to complicated grief. Here, later on, you may want to ask questions. Remember that initial response to grief and bereavement is intense longing, yearning, sorrow, emotional pain, and distressing somatic symptoms. Please read through these few points from Dr. Susan Delany. Psychological processes that can facilitate adaptation and reshape grief. Our 3 points there when we are counseling, we remember to help the patient to acknowledge the reality of loss. Then help the patient to reconfigure the relationship to the deceased after death. And help the patient to re-envision life without the deceased. These are the 3 main aims of counseling with the bereaved. What do we tell them during the recovering period? I would like to take these points from Dorothy Holliger, who has a PhD in grief counseling. She said to advise the following to the client: daily exercise, give priority to sleeping, be very careful about nutrition, stay connected with friends, families, and communities, and continue to do what you have enjoyed doing before. Even though you may not enjoy doing them now, but continue to do them. That's all I'm sharing with you. We can go now to the sharing and questioning.
Thank you very much, Sister Kristin. We will do the question and answers following the 3 sessions in this section. So we will invite Sister Kristin back on stage together with the other 2 speakers following this lecture. So we'll move on to the next lecture very soon.